It's so nice to reconnect with you. We've known each other for so many years and
Yes.
tried to, in many ways, help people for so many years. And I've been so impressed in learning about the Jed Foundation and learning how you really, with your team, have built something that's remarkable. The challenges that young adults face when they make that transition to college, for example, is really traumatic, and it hasn't been understood, and colleges haven't dealt with it. Can you tell me about what you and the Jed Foundation have done?
Yes, well, it's great to be with you, Mark. As you note, at the Jed Foundation, our focus is on 13 to 30-year-olds, and so much of that is, high school and college and the transition as you describe. What we do, one is we work with the schools themselves around everything the school can do to support emotional well-being and mental health and for the students, and to set up systems to notice if a student is struggling or has an emerging mental illness and to get them into the care that they need. The other thing we do is we work with families so that families can understand that with their high school child, their emerging adult child, what are the things they can do to emotionally prepare them for life after high school, right? So what are the independent living skills that high school student can have? Are they managing their own money? Are they doing chores around the house? Are they navigating and advocating for themselves with, at the school, for example, right? Because these are all the kinds of skills that will help them flourish in the world. In addition to that, making sure that by the time they leave high school, they really are literate in mental health. And if they have a mental health condition, that it's really planned through in terms of how is that care going to be transitioned into the college setting, right? And really thinking that whole process through. And the last thing I'll just note with regard to the transition is thinking through, right? Are you going to go to college? Why are you going to college? And where? And what is the best fit for that student, right? Then we see that a lot of times families have traditions in terms of where they might go to school, right? Or what the desired school is. And it's important to just stop for a moment and think through, like, what really is the best fit for that particular young person, right? Because when we think about the different populations in college that might be at risk for struggle, one of the groups we don't talk a lot about are the students where that probably wasn't a good fit school in the first place.
Yes.
Right? And that's an important part of the transition to be thinking about and planning for.
It is. And how do you work with the schools, identify the universities or colleges willing to work with you, and tell us a little bit about those criteria?
Yes. So schools come to us, and we also reach out to schools and promote our services. But for a school to be ready, their leadership has to be committed to student mental health and really to make it a priority, right? And so what happens when a school partners with JED and joins our JED high school program if they're a high school, or our JED campus program if they are a college or university, is that we help them form a team, a leadership team to oversee mental health if one does not already exist, that students are included in. We begin by surveying students to really understand what their experience is, what are their rates as a student population of depression, anxiety, flourishing, resilience, what are their attitudes and behaviors and knowledge towards mental health and help seeking, and safety really on that campus, right? So we collect all that data through an instrument, a survey instrument. We focus group with students because it's really, really important to understand through the student's eyes and the student experience, right, what their experience at that school is like. Then we look at what we call a comprehensive approach to mental health and suicide prevention, which is, all of the things you can do to increase protective factors and reduce risk factors. So what is the school doing to promote connectedness and a sense of belonging among the students, to develop coping skills and problem-solving skills and resilience among the students, to let students know that it's okay not to be okay. And if you're struggling or a friend, where do you get help on that campus? And that's welcomed, right? And that's invited and that's safe and okay. Then we look at all of the policies around mental health and the treatment, right? Where is the treatment being provided? What can the school do? what's being done in the community, how is the whole thing being managed. So I'll stop there, but just to say that it's very tactical and complete what we do, helping the school look at everything and then creating a plan for strengthening what they're doing. And in a lot of cases, schools are doing a lot of great things, but they don't actually have a written plan, right, that they can share and that they can understand why they're doing the things they're doing and what might be missing, as great as the things that they're doing are.
Sure,
And
sort of the gaps in that.
That's right.
So if we step back again to the high school level, let me tell you a story.
Yeah.
I went to a school with 50 kids in my graduating class, except it ended up being 48.
Okay.
My junior year, this one boy shot himself and killed
Oh,
himself.
sorry to hear that.
The school's response was to throw a 24-hour event where you ran around the track to raise money. But then what happened 4 months later is that another boy shot himself and killed himself. Can you talk some about how, particularly, in schools, you really need to focus what your interventions are in a way that makes sense?
Yes. I mean, so, how you support mental health it has to be very purposeful, right? And a part of that is understanding how you'll handle a crisis. And, to the example that you're giving, and I don't know whether this was a contagion issue or not that you described, but when someone dies by suicide, how we gather the community and heal and make sure that services are provided is critical. And yet at the same time, making sure that we are not inadvertently communicating that suicide is more common than it is, right? I mean, it's still a rare event among young people. It's the second leading cause of death, yet it's still a rare event. We want to make sure that we're not normalizing it. And when we celebrate someone who's died or we do a memorial, especially, for young people, there's a line to walk because we want to make sure that we're not inadvertently glorifying in some way that person's death. Because for someone else who's very vulnerable and thinking about dying, they can actually be motivated to go forward with their plans as opposed to seeking help, depending on the reaction they see to that other person's death and the outpouring, right, of grief and community, and that can actually contribute to the next person's death. So we call this postvention, and postvention planning is something that's very, very important. And ideally, schools have the plans in place, if God forbid a death does occur.
Yeah, unfortunately, I think that many places haven't really considered the fact that the school has to be the place for many of these interventions.
Yes.
Both the high schools and the universities. How do you change that culture?
Well, so it's such a great point. So one part of it, the beginning is just actually stepping back and recognizing that schools are the real life places that young people are for the most hours, right? So strategically, that's the place where we have the best chance of noticing and supporting somebody that needs help. And in fact, I think the data are that 50 to 70% of K through 12 students that are getting mental health care are getting it through their school. Pretty sure that's the statistic. It's a very high number. And I think among lower income populations, it's even higher, right? So schools are absolutely critical for mental health care.
Mm-hmm. Yeah, they are. It's so interesting. What is the philosophy that Jed uses in terms of engaging parents around it? Because that's such a critical piece to this.
It is. So one way we work with parents is through the schools. So when we do the planning with the schools, it's a big part of the planning with the schools, looking at how do they communicate with parents and caregivers, and how do they bring them in, and how do they support. In addition to that, we also do direct campaigns and marketing education programs, community workshops, in communities, at schools and churches and different places, talking to parents about how they can best support the emotional health, well-being, mental health of their teenagers. And actually, one of the tactics we use is to talk to them at their employers. So we partner with employers, and then the employers invite the employees who have teens and young adults in their lives, including their children, to these workshops around how to best support them.
That's brilliant. And one of the things that you really are talking about is really using a multimodal approach to everything that you're doing.
Yes. So it's a multi-layered problem, right? It's complex, and so it takes a multimodal approach to address it. So we don't apologize for that, and don't try to oversimplify it in some way. It takes a lot of approaches to build what we call a mental health safety net and culture of caring around young people.
Mm-hmm. Yeah, I think that those terms are really important for people to hear and understand. You talk about a culture of caring. Can you describe that in a little more detail?
Yes. So the idea is that the community's mental health, right, belongs to all of us. We all have a role to play. So if you're a teacher, a colleague, a friend, right, we all have a role, a responsibility, an opportunity to play as it relates to each other's mental health, right? So if I were to have, for example, a gut feeling that you were struggling with something, right, what am I going to do? And in a culture of caring, right, I'm going to lean in and say, hey, I may be off base, but I think that, something, it feels like, you might be struggling with something. Can I listen? I'm here for you, et cetera, right? And what we want is to create a culture of caring where everyone feels that responsibility and leans into that responsibility. In schools, it's amplified even more because we have caring adults and we have children, right? And what we need is for all of the caring adults to see this as part of their responsibility. But I want to call it an opportunity, not a responsibility, an opportunity to help care for the students in their school.
How long does it take to really successfully create such a culture within a school?
It can take years, it really is culture change. And so, and you need to thread it through all of the policies and the approaches, right? And the culture, and leadership has to be behind it. And it needs to be able to withstand turnover. So you always have to work at it, right?
Yeah. So in closing, what should we take away from this? What would you like us to know, and where would you like us to be in 5 years?
Well, okay, so a couple of things. I would say that every person, so we, the JED Foundation, but many others who work in youth mental health, we tell young people that if you're struggling or a friend is struggling, go to a caring adult. So I would ask everyone to think about, who are you a caring adult to? And does that young person know that you are a caring adult for them? And tell them that. And make sure they know that you're a safe harbor and a caring adult, and be more active in that role. Then for those that are in communities with schools, talk to your schools. Do they have a plan? Do they have a written plan, right, around how they're supporting student mental health? And they should, and I don't say this in a gotcha kind of way, but in a way that, the JED Foundation and other groups can help them do that. It's really important to have a thoughtful, comprehensive plan and planning process at every one of our schools in the country.
Absolutely. Thank you, John.
Thank you.